Welcome to the third episode of the Eliminate Cancer Foundation podcast. My name is Ms Asiimwe, your host, and today we shall be talking about breast cancer. From the previous episode, we talked about how to care for cancer patient, how to be patient with them, and help them cope with the situation. Today we shall be talking about breast cancer. Breast cancer is a disease for both male and female. It is a disease where cells in the breasts grow out of control, really out of control. It often begins with the cells in the milk-producing ducts. This means the females are at a higher risk of getting this kind of cancer. And of course, the risk of breast cancer increases with age, meaning the people at a higher risk are the women and the elder women, mostly around above age of 40. Breast cancer affects both the body and the mind. It comes with a situation of having to cope with the fact that you have cancer, and then the physical changes that come with the fact that you have breast cancer. It is really a sad one that affects the mind. And of course, the mental well-being is also at stake if someone is diagnosed with cancer. And the signs of cancer and symptoms of breast cancer can vary for different individuals. Some of the symptoms could be a lump in the breasts or just a thickening of the breast tissue. And this lump or the thickening comes with discomfort of the breast. Of course, it affects the individual, and as the lump keeps on increasing, meaning the breast tissue is thickening. For some individuals, there is that unusual bloody discharge from the nipple, and this nipple could also be an inverted one. Usually, it could be one that is retracted, turning inwards. Sometimes the entire breast is swollen. Even if there is no lump that is felt, the breast could all be swollen or even just part of it. At times, the skin changes around the breast. It could be reddish, and of course, it is tender, reddish, and really the breast has grown in size. When you see all these symptoms, it is good to at least seek for help, medical help, talk to a medical professional, talk to your doctor or talk to your counselor. You could seek help. And oftentimes, when you see these symptoms, a diagnosis is actually needed. And the commonest diagnosis that is done is to do an X-ray of the breast, and it's a screening test that is called a mammogram. A mammogram is highly advised for women that are 40 and above, at least each year. It is actually better for each individual to keep testing so that one is not caught off guard. This mammogram helps to detect breast cancer up to 2 years even before the tumor can be felt by the doctor, by physical examination. So if the cancer is detected before the tumor, meaning there are very high chances of someone actually getting healed. And breast cancer is actually curable in the early stages, stage 1 and stage 2, meaning at least a screening test is needed as early as possible. When someone is diagnosed with cancer, of course, there's need to go on treatment. Of course, it needs some kind of counseling, helping the patient realize, helping the patient accept that yes, it is breast cancer, and if it is at early stages, to give them hope that they can actually be well. But if someone did a diagnosis and actually they found out they're not yet to the level of having cancer, it is also wise to advise the individuals on how to reduce their risks of breast cancer. this is especially to the women that are above age of 35. It is highly advised to limit the use of birth control pills. And of course, it affects more the women that are above 35 years of age. They stand a higher risk. But even ladies below 35 also have a risk. So the advice is to limit use of birth control pills for the ladies and avoid a sedentary lifestyle. The sedentary lifestyle is actually risky. It could be sometimes a careless life without knowing that maybe you're going to end up with a lot of junk, be obese, and have dense breast tissue. It is also risky, so it is advised to avoid that. Then also avoiding radiation therapy to the chest. The chest area has the breasts on it. Before any age of 30, radiation therapy is not good. It affects the cells that actually end up dividing rapidly, and cancer could actually result. Then it is also advised to avoid taking certain hormones for menopause. When menopause comes up, there are a lot of things that come with abnormal menstrual cycles, the hot flashes and all that. So women in menopause are forced to take certain drugs, and these are drugs that contain hormones. When you take these drugs too much, it could actually increase the risk of getting breast cancer. When someone is diagnosed with breast cancer and its treatment come with a lot of effects. It of course changes how someone feels about their body. Someone has to cope with the scars, the pain, the weight loss, weight gain, the thinning, and also some of the effects are also loss of sex drive, like those are the sexual side effects. Then there's also changes in the sensation, loss of self-confidence. All these effects come with cancer. It is really so sad that someone is affected, of course, psychologically, mentally, and physically, because when someone loses self-confidence, someone is not bold enough to stand out. But of course, we have a role to play in society. How do we help these patients? How do we help them fit in society? And a bit of how to care for the patients was covered in the previous episode. Today is just giving highlights about the breast cancer. Then also about breast cancer, it is also very key for any human, whether male or female, to take very good care, like to be so keen about the size of the body parts of the breasts. How for the gentlemen, it's usually just something small. But if you wake up one day and you notice it's something bigger, it should raise concern and diagnosis should quickly be made. Then also for the ladies, when you know your appropriate size of the breasts, any kind of change, of course, you'd have to call for help, to seek medical help. Then it is also advised that with breast cancer, early screening is very, very, very key, because it is curable just like any other cancer. So, advise of each of us, whether male and female, to look out for each other, to help a friend. It could be a medical profession out there, and you can advise a friend on how to limit the risk of having breast cancer. Even those that already have the signs, to visit a doctor. By the way, even physical examination is possible with a friend, with a medical doctor, so that you can have to curb cancer and also help cancer patients survive better. Thank you very much for listening.